Welcome back to Sleep Talk with Dr. Dev. My name is Dr. Dev and this is my assistant Barney. Hey Barney, how's it going? All right, Dr. Dev. Today we're going to talk about a very important topic, and that's dementia and sleep. Sadly, as the world grows older, we can have a lot many people having dementia. The commonest dementia is Alzheimer's disease. The interesting feature of Alzheimer's disease and sleep is that almost half, 50% of those with Alzheimer's have sleep problems. And this in fact has an immense impact on the carers, whether it be the family or within nursing home or aged care facilities. And the sort of sleep problems I'm talking about is getting to sleep, staying asleep, whether that might be made worse by anxiety and mental health, but also something called nocturnal wandering because of sleep reversal. In other words, the circadian rhythm or the sleep cycle is completely upside down with Alzheimer's, that they stay awake all night and they're asleep all day. Now, no wonder if anybody, as we know, don't sleep well, then this will have an impact further on how you feel in the day with your focus, your memory, your concentration. So in those with Alzheimer's and dementia, getting good sleep is hugely important with regard to their cognitive functioning. Now, many patients with Alzheimer's and dementia also have other medical reasons for the sleep disturbance. It might be sleep apnea, it might be chronic pain, obviously depression, and other things like urinary tract infections or gastroesophageal reflux disease. But the majority of those that I see with sleep disorders, particularly the impact on sleep reversal on the carer, makes it a huge priority for me as a sleep physician. And interestingly, a recent paper in Australia has shown, looking at aged care and looking at medication many people with dementia in aged care facilities take, they're using a lot more psychotropic drugs really to sedate them. And these drugs include risperidone or haloperidol, quetiapine, olanzapine, and others like benzodiazepines, such as lorazepam, diazepam, temazepam. Clearly not ideal in this very vulnerable age group with the risk of falls, the risk of further confusion as well. We have tried melatonin in many of these patients to try and adjust the circadian rhythm, but there's issues with regard to how well melatonin works, probably related to the melatonin receptors in the brain and how that has been impacted upon by the dementia process. And certainly those with Alzheimer's disease and dementia who've got immense issues with aggression as well, although that's a minority, but it's an important part of aged care where we look after many of such patients because they can't be looked after at home, then getting the right medication is hugely important. So as we move away from those psychotropic drugs like risperidone and olanzapine, we're looking at alternatives. And there's been more and more interest in the role of cannabinoids such as CBD oil or cannabidiol and tetrahydrocannabinol or THC to be taken at night time to help with aggression, help with nighttime wandering, help with sleep. Now, CBD is very commonly used for also anxiety and the hyperarousal, and I've had a lot of success with CBD in the day as well to assist with anxiety and that well-being improvement as well. So if you're a carer of someone elderly and who's having issues with sleep because of dementia, then go and speak to your GP and get a referral to a sleep doctor who has an interest in cannabinoid medicine, as I do feel the consideration for CBD oil, with or without the THC, would be something worthwhile thinking about, not only for that vulnerable individual, but also for the carers who are looking after him or her. I hope that's been helpful. I will see you next time.